We're now going to move on to a topic and discussion on reproductive health, sexual health, and pregnancy experiences of women with spina bifida. And there's going to be two separate speakers involved in this presentation. So I'll give you a little background on both of the people that you're about to hear from. First of all, Dr. Berndl is a maternal fetal medicine specialist at Sunnybrook Hospital and is the founder and director of the Accessible Care Pregnancy Clinic. She is an assistant professor at the University of Toronto and an associate scientist at the Sunnybrook Research Institute. She is the chair of the U.S. Spina Bifida Association Women's Health Guidelines and is involved in multiple research projects in the field of pregnancy and physical disability. So speaking with her as well is Asia vanBuuren, a senior medical student at University of Toronto. She is a research assistant at Sunnybrook Health Sciences Center and has worked with Dr. Berndl doing research on the reproductive health needs of women with spina bifida. And she has a community development background and is passionate about disability justice. So we will turn it over now to Dr. Berndl and to Asia vanBuuren. Thanks very much.
Hi, everyone. So I'm Asia. Thanks for the introduction, Eric. So I'm here on behalf of Dr. Berndl and myself. I'm so sorry to let you all know that she's currently working in the hospital and she was really hoping to join us this morning, but if she is not here, that means she is helping bring babies into the world. So hopefully she can join us for part of the presentation, but if not, if there are questions specifically that you want directed to her, you can send them to me, and if we feel like her expertise might be better able to address your question, we can email her and sort that out that way. So we're really grateful to Hydrocephalus Canada for having us, and they've worked in partnership with us on this project and actually helped fund my contribution to the project. So really grateful. Thanks so much for having us, and we're excited to talk to you today. Okay, next slide. So today we're going to talk a little bit about what inspired the study and some of the background information regarding the study. And then we'll talk about this kind of larger survey that we've been doing, looking at the reproductive health and pregnancy needs of women with spina bifida. And then we're going to narrow specifically into a qualitative study that I have been part of with Dr. Berndl. This was the piece that specifically was funded by Hydrocephalus Canada and that we're going to focus our results sharing on. Then we're going to talk about our plans for future research, and we'll be happy to address any questions anyone has. Okay, go ahead. So in terms of some background, spina bifida impacts a woman's reproductive health in a number of ways. So for example, sexual health and well-being, the contraception options that women can use throughout their reproductive lifespan. And then there's this kind of two-way path in terms of the impact of pregnancy on spina bifida and the impact of spina bifida on pregnancy. There's also unique concerns surrounding birth and postpartum in women with spina bifida. And so Dr. Berndl has been a part of an amazing group of individuals who's been working on these guidelines, looking at women's health and reproductive health needs throughout a woman's lifespan. And so they're currently in the phase of getting these guidelines peer reviewed, but the preliminary findings are available on the Spina Bifida Association's website. So there's this large guideline that they've been working on with 58 different recommendations broken down based on age, and then really just focusing on the women's health piece. So gynecologic health, antenatal care, birth care, breastfeeding, and then menopause as well. Go ahead. Thanks. And so as they started writing this guideline, they realized that there's kind of this global lack of information surrounding a lot of the questions that they had about a woman's reproductive health. And so that inspired Dr. Berndl and her team to start a study called the Women with Spina Bifida Reproductive Health and Pregnancy Study, which is an international study that's currently in the analysis phase that I'll tell you a little bit more about. So this was an online survey and interview guide that we designed with input from members of what was the Spina Bifida and Hydrocephalus Association of Ontario. We recruited women from around the world to participate in an internet-based reproductive health survey that asked questions about sexual health, pregnancy, labor and delivery, impacts on spina bifida. We distributed that survey via websites and via advocacy groups in Canada and internationally. Go ahead. And so In terms of who participated in that study, we had 253 eligible women with spina bifida from 14 countries participate. They were an average age of about 38 years old. 131 of the participants had experienced pregnancy, so about half of the folks who participated, and a total of 273 pregnancies were described. And so at the end of that survey, if women felt like they wanted to talk about the survey questions in more detail, they could indicate their interest in participating in a qualitative study to discuss the topics more. And so we created an interview guide that asked open-ended questions about sexual health, reproductive health, and pregnancy. And those who said they were interested, we contacted them by phone. And I had the privilege of interviewing those women, and then we transcribed the interviews and analyzed them for themes. And so I interviewed 12 women, ages 28 to 57. 5 were in Canada and 7 were from outside Canada. Most of them were in the United States. And participants had a range of no pregnancies to 3 pregnancies, and a total of 12 deliveries were described. And so I'm going to share, I want to focus this talk on the results because Dr. Berndl and I think that the results of the study are really powerful and insightful, and the women who participated really wanted their voices to be shared. So we're excited to share what they talked about with us, with all of you. So the results kind of are split into 4 domains: sexual health, pregnancy, labor and delivery, and the postpartum period. And then there's kind of this overarching and intersecting domain of social justice and self-advocacy that was prevalent throughout basically the entirety of the study. So I'm going to start with sexual health, and I'll share some of the themes that came up, and then I'll share quotes directly from the participants as well. So in terms of sexual health, 9 out of 12 of the participants described their sexual health experiences and the information that they received as negative or neutral. So very few said, yes, I had a super positive experience. 10 out of 12 participants did not receive any sexual health information tailored to their spina bifida. Only 3 were taught specifically about abuse. And for many participants, sexual health was not discussed with them by their healthcare providers unless they brought it up themselves. So in terms of quotes, one is, it's like they can tell you stuff they would tell everybody else, but then when it comes to spina bifida, it's kind of murky waters. Another said, I guess my doctors figure, oh, well, she's not going to go there, so we don't need to talk about it. They didn't think of us as sexual human beings, as people that needed that kind of information. So then moving on to pregnancy, we asked women about the impact of pregnancy on their function, and difficulty with self-catheterization and urinary function was the most commonly described impact from participants, but others talked about things like chronic pain, decreased mobility, and mental health concerns. And then in terms of general support for pregnancy, support from healthcare providers was mixed. For some, a supportive healthcare team was the highlight of their pregnancy, and others were encouraged to have an abortion by their healthcare providers. And then there was this kind of like global lack of information and experience. So participants described not being able to reliably find information about how being pregnant would impact their spina bifida. And they quoted a lack of research and lack of experienced healthcare providers as potential reasons for this. So here's some more quotes. One says, I went to a GP. She was very gung-ho on, oh, you'll be wanting me to organize an abortion for you. Like, it was very cut and dry as far as she was concerned, and I was being selfish by considering having him. Another said, getting a team of doctors together that really knew what they were doing. That's just the best thing that's ever happened to me. Another said, I think she, referring to their doctor, tries to provide the best knowledge that she can, but she hasn't had any patients with a similar situation, and there's not a lot of research on it in terms of outcomes. And then in terms of labor and delivery, there were 12 deliveries, like I said, that were described. 7 were vaginal deliveries and 5 were cesarean sections. No participants had a successful epidural, and many were told that they couldn't have one. So those who had cesarean sections had a general anesthetic. In terms of attitudes towards delivery, some participants were really eager to have a cesarean section due to their comfort level with surgeries in the past, and others described doubting their capacity to participate in a vaginal delivery due to decreased sensation and lower body strength. So some participants were quite anxious about that. And then in terms of complications, 9 of 12 deliveries occurred preterm, but some described this as a positive aspect of their pregnancy due to some of the complications that they were experiencing. So more quotes. One said, I was dying to have a C-section. I don't know why, but that was not as scary as natural birth because I've had many surgeries in the past. Another said a positive aspect was the fact that I didn't carry her to full term because I'm not sure how my body would have reacted to that pressure, that weight. That's something I was very concerned about because of my mobility issues. Another said, the doctor had said your body will know what it needs to do, and if it doesn't, we'll do something different. That was always a concern for me. Just how was my body going to do it? Am I going to be able to do it? Okay, so then in terms of the postpartum period, women also described unique parenting challenges. Many of the challenges they experienced were related to mobility, and they described coming up with creative solutions to these issues, often through trial and error. And some women faced overt discriminatory attitudes while parenting. And then this theme of emotional well-being also came up. So some talked about the intersection of emotional and physical health in pregnancy and postpartum. And if healthcare providers asked participants about their mental health, it was really highlighted as a strength. So more quotes. One said, it was just concentrating on finding ways around how I was going to mother, just the physical side of things, but I had great faith in necessity being the mother of an invention, and I was able to work it out in most cases. Another said, my doctors are the ones that actually recommended I see a therapist. I was really impressed with them for even noticing that I was needing that. And another said, I was able to, on my crutches, pick her carrier up, go to the car, get in there and walk with my crutches to carry her inside places. And we just managed to do it that way. We just figured it out. And then there's kind of this broad overlying theme of social justice and advocacy. So you'll notice that these themes were prevalent in all of the aspects of a woman's reproductive health span that I just spoke about. But three main things came up. One was the importance of connecting and lived experience. So connecting with women with spina bifida was really important to participants, and some felt that women with spina bifida could provide more insight into their concerns than healthcare providers. And then I talked a little bit already about discriminatory attitudes. So unfortunately, discriminatory attitudes in sexual health, pregnancy, and parenting were commonly described by participants, and some faced overt discrimination. Participants described this being mediated by people with disabilities not being viewed as sexual or capable of parenting by society at large. And then this theme of self-advocacy came up a lot. So this was really central to participant reproductive health experiences, and many discussed advocating for their right to be pregnant and parent, seeking multiple medical opinions, and advocating for information. So a few more quotes. I feel like people with disabilities aren't treated like sexual beings, and that's negatively affected the lack of information that we have. Another said, I think the best part has been able to prove to myself and to other people that I can do this. The disability community is always told you can't, but I can, and I did, and I am. The third said, try to talk to a mom that has spina bifida and that has the experiences you're looking for rather than going to a doctor. Okay, so in conclusion, this is a quote from one of our participants that to us really describes why we do this work and why we believe it's so important. So they said, we deserve the same type of care that anybody else receives in regards to sexual health and pregnancy. And so our study identified unique reproductive health challenges that women with spina bifida face, which include limited availability of information tailored specifically to women with spina bifida, discriminatory attitudes, functional challenges while pregnant and parenting, and a lack of experienced healthcare providers. And when we did this research, we noticed that there really wasn't much else out there. And we noticed participants shared with us that self-advocacy, speaking with women with lived experience, and further research regarding sexual health and pregnancy in women with spina bifida were really important. And we believe this demonstrates the need for further research and healthcare provider education to improve the care of women with spina bifida in their reproductive years, such that they can receive the same quality of care that anyone else receives in sexual health and pregnancy. So we have plans for future research, but we would love any feedback or suggestions that individuals have. So as I mentioned, we have this large international study that has generated a data set for us. And we're currently analyzing that, and there's more research to come from that. We're looking specifically at impact of pregnancy on mobility, association between bladder and kidney health and preeclampsia, reasons for cesarean birth in women with spina bifida, and outcomes of planned versus unplanned pregnancies. But we're currently generating questions, and if anyone has any suggestions, we'd love to hear them. And Dr. Berndl and I are both very passionate about the fact that further research and advocacy is needed to begin to address barriers identified by women with spina bifida seeking reproductive healthcare needs through supporting both them and their healthcare providers. So these are our email addresses. You are very welcome to reach out to me, and I can get in touch with Dr. Berndl, or Dr. Berndl is very happy to accept questions by email. This is one of Dr. Berndl's patients that is shared with permission. And again, we're really grateful to Hydrocephalus Canada for having us, and I'm happy to take any questions that anyone has.
Thanks very much, Asia. And I'm glad you mentioned the emails, because I had a feeling that some people might be asking for that, because obviously it's a topic that some people may or may not be comfortable with discussing publicly like this. So perhaps they might have personal or private questions. So thanks for passing that along. And we'll make sure that maybe we put those down in the chat function as well. So anybody that maybe isn't copying this last slide right now, we'll leave it up there so you can see it, folks, and you can write it down yourself, but maybe we can put it in the chat function as well so that people have it. So again, any questions that you might have, you can either send them privately, but if you care to share them publicly right now, we can certainly address them. And we do have at least one that has come in here, Asia. Will pregnancy be hard if one has a weak bladder?
Yeah, so that's a great question. And it depends on kind of if you're self-catheterizing or what your bladder function is like. But definitely some women shared that just the fact that as their belly got bigger, placing pressure on their bladder, they just felt like they were leaking all the time. And some women also, if they had pre-existing kidney issues, had kidney infections in pregnancy as well. So that kind of depends on what your bladder function is before you're pregnant. And again, is why this research we believe is so important, so that people have a better sense of what to expect. So I would say that just as you get more pregnant, you can expect some difficulty with like really frequently going pee, which women without disabilities report, but is more difficult, I think, for women with spina bifida based on what we're seeing so far.
Another one that came in via Facebook. What are the dangers to someone with spina bifida delivering naturally, especially if they have Arnold-Chiari?
Yeah, that's a great question, and something that based on my experience, I may not be able to address. So we can ask Dr. Berndl, but so the kind of like delivering naturally, as in having a vaginal delivery versus cesarean section, the biggest difference between those is the type of analgesia or pain control that you can have. So because of where spina bifida is located, most women cannot have an epidural just because it's dangerous. So then you would be having a vaginal delivery without any pain control. So that just depends on your personal preference. But then in terms of the impact on what you were asking about, I'm not actually sure. So I can ask Dr. Berndl to see if we have any information on that and get back to you.
Okay, we do have another one here. Sure. Has there been a reach out to all the spina bifida clinics across Canada regarding this topic to teach sexual health at the clinic or clinics?
Yeah, that would be amazing. And so we would love to, once we have more tangible information to share. That's definitely something we're kind of in this transition period now where we want to share what we found in our research with healthcare providers specifically. And we definitely believe that healthcare providers need more education such that they can provide inclusive sexual health information to their patients. So certainly that's a wonderful idea and something that Dr. Berndl and I can look more into, but we haven't done that as of yet.
Okay, Asia, I think that's it right now. I'll give it just another second here if anybody else has anything that they want to type in. Oh, there was one here. Sure. Did any of the participants, to your knowledge at least, did any of the participants have issues with their shunts?
So my understanding is some did that required surgery, like either during, like surgical correction, either during pregnancy, before or after. But it didn't come up in the interviews any direct implications, shunts on their pregnancy, actually. Yeah. Good
All right,
question.
and another question has come in just based on one of the answers that you gave actually as well, just a couple of moments ago.
Yeah.
Could you explain how having an epidural could be dangerous, especially if they didn't know a person has spina bifida?
Right, and that's a really good point. And so I shouldn't say necessarily that it's dangerous. Just right now, based on if spina bifida is known, it's just a preference of anesthesiologists currently in practice to not put the epidural catheter into the back because it goes between the bones in your spine. And so just based on where your lesion is, most people want to kind of stay away from that in terms of an epidural. So I shouldn't say necessarily it's dangerous, but it's difficult to do an epidural in women with spina bifida. But again, that depends on where your lesion is. And certainly if people, it also depends on the degree of spina bifida. So if you don't know that there's spina bifida, then I'm not sure. Then they may still try an epidural and maybe it would work. So dangerous wasn't the right word maybe, but more difficult is maybe what I should have said. But some women instead, if like they had known spina bifida and they were told they couldn't have an epidural, some women received IV pain medication. So pain medication through like a thing in their arm with fluids. And some women found that helpful and others just went without pain control completely.
Okay, and a quick follow-up to that. The same woman was asking if you could maybe go over perhaps some of the other complications that could result from having it. I'm assuming that being the epidural.
An epidural? Yeah, so there's, so the other complications just for any women is it doesn't work. So it goes in, but then it's not successful. And we actually had one participant who a very experienced anesthesiologist attempted an epidural, but it didn't provide her any pain relief. So it wasn't actually successful. That's a risk. Another is like bleeding where at the insertion site or infection at the insertion site, or people can get a headache after an epidural. It also can slow down your labor. So that's something that we consider in women who are in labor. It can slow things down a little bit. So all of those complications that apply to all women would also apply to women with spina bifida. And then specifically, it would just be a concern about where your spina bifida is located and not wanting to hit it with the epidural needle, not wanting to interfere with that in any way. I'm sure that I'm not addressing this question properly. So if this individual can also reach out over email, and if Dr. Berndl has more clear answer to that, happy to speak to that.
Okay. I think that's it, Asia. Thank you very much. We appreciate it. Thanks for your time. And again, folks, you've got the email addresses there for Asia or Dr. Berndl. So thanks again.